Good afternoon, good morning, good evening, wherever you're in the world. Today's guest is Amally Ding. She's a PhD student at King's College in London, and she's also a pharmacist. And she's going to be talking about some research that she's doing at the moment at King's College in London involving patient research. Good afternoon, Amally. Can you tell us a bit more about the research you're doing at King's, please?
Sure. Afternoon, Jim. So basically, at the very moment, my project is a survey, looking at basically testing out if this consultation model I have developed in Chinese medicine can be applied to other forms of complementary medicine. So that would be like homeopathy, osteopathy, and like Ayurvedic medicine as well. So it's open up to anyone who uses complementary medicine. And this model, I guess, I probably should start at the very beginning of my PhD, or I mean, I can even start even further with like my research journey. But at the very beginning, like what I really hoped to do with my research was to integrate the two forms of medicine. So at the moment, it's really classified as complementary and alternative medicine and conventional biomedicine. So basically, your GPs, your conventional biomedicine, and everyone else is basically classified as complementary or alternative. And so I mean, I can tell you, like when I was working in hospital back home in Australia as a pharmacist, I was on the ward, and I came across one patient who refused any of the blood pressure medications that she was being prescribed, despite her blood pressure being 200 millimeters of mercury high. Like it was, and the neurology team were there, and the cardiovascular team were there, trying to like convince her. We were trying to convince her as well. Like, I really need this medicine, but she refused it all. And she was adamant on only having homeopathic medicine. She was saying that this is the only thing that works. And for me, it was like there was two things that came from it. So the first thing was, I mean, some people took the stance like, oh, complementary medicine is bad because it basically caused her to only believe in that and not take any conventional medicine that would actually help her reduce her blood pressure and prevent a stroke. But the other perspective is actually very apparent to homeopathic medicine. And for me, the way I see it is like, why can't we integrate the two? Why can't we take the best of both worlds to help patients rather than just one is better than the other? And maybe there's something in homeopathic medicine that we can apply in conventional medicine. So that's why I started doing research in adherence. So the extent patients take on medical advice or stick to the herbs or like medicines, and in particular, and one aspect of that is, I think, is the interactions that practitioners have with patients. I mean, complementary medicine, like adherence in complementary medicine, isn't very well researched. A lot of people look at like adherence to conventional medicine and the impact of taking complementary medicine, or they look at how much it's being used, but they don't actually look at how well people stick with it. So I decided to look into this area, and so then the first study that I did with my PhD was a systematic review, just trawling through the literature, trying to answer the research question of what are the attitudes and beliefs towards complementary medicine that affect provider-based complementary medicine in adults. And there were like thousands. I went through over like 9,000 abstracts, came down to, I mean, because there was just too much to manage. I had a strict inclusion criteria for the studies and ultimately just used 8. And it was still very hard to synthesize, like with, I mean, I couldn't do meta-analysis. So the results basically were just were narrative, and could be divided into attitudes and beliefs. In terms of attitudes, greater motivation, although this one wasn't particularly statistically significant, but greater motivation, agreement towards therapy, positivity towards treatment, and appreciation of training. These attitudes helped influence adherence to complementary medicine. And in terms of beliefs, it's holistic health, therapy being too expensive, positive perceptions of therapy. It wasn't too much effort seeing the therapist. Treatment being highly effective, although again this was surprisingly not statistically significant, but also understanding treatment philosophy indirectly through illness perceptions that actually did influence adherence. So like illness perceptions is such as like poor past care, a cause of ill health. So, but in summary, really, the conclusion was strong beliefs in holistic health and positive attitudes and perceptions of therapy, as well as appreciation of complementary medicine is associated with adherence. Yeah.
And I find it really interesting. I think it's a really interesting study. And you mentioned there holistic health, and it's quite fascinating how, obviously, with your background in pharmacy, how you've gone down that road. I have an interest too in Ayurvedic medicine and ayahuasca as well. I've done my own independent research in the literature, nothing official, just my own independent research, and I've seen some really interesting findings around ayahuasca, around Ayurvedic medicine as well. Obviously, I'm not going to make any recommendations in that respect, but I find it really fascinating how alternative, you can call it alternative or complementary, whatever you want to call it, it's entirely up to whoever call it what they will. But it's fascinating because I think that it is, like you mentioned there, looking at that holistic approach, and I find that sometimes having that sort of reductionist approach where we try and focus too much on one thing causes the other rather than uncovering every stone. And that's why I think it's quite useful to look and explore other areas, because I don't think personally science has all the answers, but it has some answers. But I don't think that we know. I don't think we know enough only to rule anything out. I think we know too much to say one thing is the only way. And I certainly, irrespective of whether it's Ayurvedic or whether it's chakra balancing or it's ayahuasca or mainstream medicine, my apprehension always is that having a reductionist approach minimises that chance of helping people to improve. Holistic being true holism, let's uncover every stone and help people to improve. And I think that irrespective of whether it's considered holistic, because some people who call themselves holistic, in my opinion, are more reductionist than the people they call reductionists, because they try and attribute health or well-being, one thing causes the other. You know, an unbalanced chakra or an unbalanced constitution, or one thing or the other. And in turn, it's ironic because some of the people who call themselves holistic are probably more reductionist than people they call reduction. And I think it's really important that people like yourself do this sort of research, because I think there's a lot to offer. And I'm just curious to know what your motivation was. And I mean, it's not often, well, it's getting more and more now. I think that it's taken a while, certainly in science. I don't think, in my experience, a lot of people who are and have got what I would consider the open mind. But what's been your motivation to, out of interest, to sort of explore this area and spend so much time and dedication around this research?
So I guess part of it would be personal experience, because I was very like science-based, very like, you know, empirically science-based. And when I saw a traditional Chinese medicine practitioner myself, I was very like skeptical, and I was like, oh, I don't think this works. But when I received treatment and actually experiencing efficacy from it, I was like, I had to open my mind, otherwise that would just be ridiculous and just denying that it doesn't work. When I experienced that it worked, then I felt like people need to know and should have an open mind to it. Like, it works, and I want to, I mean, it's too far to say I want to prove that it works, but I felt like I needed to get people to have that open mind and help patients in the best way possible. So yeah, I mean, I came across this with my second study, looking where patients had also said that they really appreciated practitioners having the like looking at them holistically, and but also the having that open mind. Like, they really appreciated it wasn't just CAM, being a CAM practitioner. They were also would recommend a patient to have the chemotherapy that their specialist had suggested. If they were initially against it, they would. I mean, this is of course depending on like the circumstances and if it was appropriate recommendation, but it wasn't just like, oh no, we only use complementary medicine. No, it was just like, we want you to be healthy. That's the most important. We will employ all methods possible for that. Yeah.
I think that's a good attitude to have, to in a positive way to get the best of as many roles as possible and to give people the best chance. I don't think one thing will work for everybody. I don't think there's one approach to all. I think certain things might work better with certain people. You've got biological factors, genetic factors, environmental factors, psychological factors, social factors. There's so many things that are multifactorial. And I think that's the challenge with any treatment, certainly from a psychological point of view. Things are very multifactorial, and I think that, in my opinion, anyone who sort of says one thing, this is for all, I tend to sort of shut off, because I think that, okay, these things are multifactorial, and we've really got to be holistic and uncut every stone. I think treating people as an individual, individualizing treatment for me is the way forward. But that's obviously another story for another day.
No, but that again, the point that you just brought up came up in my second study, where patients said that that was one of the main things, is like tailored therapies. I'm trying to think what else came up. Holistically tailoring and also checking treatments. And one of the things with tailoring the treatment, it shows that the practitioner has been really listening to the patient and altering every single time to, I mean, with Chinese medicine at least, I know in other medicines to do as well, but my study was done in Chinese medicine, but where they alter the herbs slightly, or they add in or take out one depending on how they the pulse felt, or how the symptoms that the patient was describing. So patients felt like they were listened to, they were understood as well. Yeah.
No, that's really interesting stuff, and it's fascinating because I've been doing some reading and reading the literature on ayahuasca, and I think at the top of my head is the University of Johns Hopkins that's done a lot of research in the States around that area, and from a scientific point of view, we look for scientific correlations. And on one of the papers I'd read a while ago, they were talking about how the shamanic people in the Amazon seem to know what to mix with what, and if you ask them, how do you know, these are my words, not theirs, they tend to follow the intuition. So I don't think in the scientific world that's going to stack up, but equally in saying that, it seems to work for them. And the fascinating thing is a study, and I don't recall who did the study off the top of my head, but anyone who's watching is welcome to email me just to clarify. But there was evidence that the openness trait, the big 5-factor model, one of the traits is openness. And there was evidence that a year after a certain type of psychedelic, I think, ayahuasca was taken, that they'd seen an increase. Now, whether that's a good thing or a bad thing, it's anybody's guess, really, in that respect. But equally, it showed there was evidence there. But equally, some of the studies at Johns Hopkins were around people who had depression, for one reason or the other, and they did show some improvements. I'm mindful of time, and maybe we'll speak again and follow things up in a while. I can sort of find some of this literature. It's really fascinating literature at Johns Hopkins, and also I believe that there's some studies in the UK. I saw a program around that area, and it's really fascinating. I think that it's obviously sort of going off piece to what you're doing, but it does go to show that with what you're doing, that there's a lot for us to learn, and I think that there's so much for us to take on board, at least consider it, certainly, for sure, definitely. And in terms of yourself, you mentioned Chinese medicine. Is there anything specific about Chinese medicine, anything specific in the area of Chinese medicine that you'd like to sort of cite or mention, or you've seen any significant improvements?
Well, I am not able to compare it with other forms of medicine yet because the survey is still ongoing. But with the Chinese medicine, I had done it in this area also because of my heritage or my background. So I thought there were some if there were language barriers, I could perhaps I mean, there wouldn't be language barriers in terms of understanding and also culturally understanding, what was happening inside, because some people might find certain mannerisms unacceptable, whereas other mannerisms were. So, for example, there were some patients who specifically sought Chinese, ethnic Chinese practitioners because they felt that they could understand their need, the practitioner could understand their needs much better. And I remember one patient saying to me she wants all the advice, on what she should be eating and everything that she should be doing to help prepare her pregnancy. Whereas when she went to a GP, the GP's like, oh, well, keep trying. That, that was it. There wasn't much advice. It's like, you're healthy, just, keep trying. Whereas she's like, no, I really want that advice. And the practitioner could understand without her saying, tell me all the advice. The practitioner can just give that advice. And it didn't seem like the practitioner was overstepping the boundaries, or if the GP was worried about doing that, something like that. Or perhaps maybe they don't have the expertise, because in Chinese medicine we also have the food, the food therapy side of things, where everything you eat matters, or you should eat certain foods for certain syndromes or certain conditions. So it's very, I mean, some people might find that very it's too much, but some people really like it.
Yeah, no, definitely. I think so. I think that there's a lot of anecdotal. People speak from their own experiences, and certainly in my experience, I spoke to the people and they talk about how certain treatments help them. And for example, a while ago, I was leading a course, and someone had mentioned the course. A woman had mentioned the course that she was told. I'm only going off what she told me, by the way. I don't know if it's factual, but she was told by the GP or a specialist, I believe, that she couldn't conceive, and she then seeked different treatment. I don't know the extent of the treatment she looked for, but it involved her diet and gluten, one thing or the other, and she'd said that it helped her, and she ended up conceiving and having the baby, and the baby was healthy. But I can only go off what she says. So obviously it's anecdotal, and we see a lot of anecdotal stuff out there these days. I think the internet's quite useful in one respect, because you can sort of speak to people and communicate with people like we're doing now. But on the other side of things, I think sometimes a little bit of knowledge with some people, it goes back to the old theory that sometimes people overestimate what they know, and the danger is that one thing might not work for one person, one the other, and whatever that might be. I mean, I've seen over the last few years people make all sorts of claims about certain things over the internet, and I'm very hesitant to comment. It's just not my place to comment on that. But from the outside looking in point of view, I would always suggest people, think really carefully and never substitute anything for, obviously medical advice. But equally saying that, it's sort of that balance, because you can see people can be vulnerable if they're not well, and they can sort of turn to all sorts. And I think it's sort of balancing things out. That's the area for me. And I was teaching a course one time, and this woman was adamant that CBD oil had a big impact on someone in the family around a certain condition. And she asked for my thoughts, and I said, well, I don't know enough about it to comment, only other than the bit of reading I've done on the literature when I've done dissertation. But equally, what I would say is that there is a danger that we don't know enough about certain things, and I guess the danger is that that might have worked for her auntie or a cousin, whoever it was, but then in saying that, there's so many other correlating factors that might have contributed to that. But equally, I suggested that her being open about that, depending on the type of oil, by the way, out of 10,000 people, someone could administer that, and there might be property in there that could cause, a site. I know they extract that property in the oil that's unbelievably legal in the UK, but equally saying that there is always that danger there could be property in there that could cause psychosis for some people. And also young people might think, you know what, it's okay to consume that without the full extent. So I think it's a balancing act for me, and I always think it's in proportion to the situation. I think for me that's key, knowing that people, you know, when they are, or they're very vulnerable too, and sort of, you know, a fine line. So I certainly wouldn't dismiss anything, and I don't know enough to dismiss certain things, but have that open mind, but also be cautiously optimistic too, I think. And I think studies like yours are great because they put things on the table, and it's taking things forward really. And that's what we need to do, because I think we've gone so far. We're on the edge of the pier, I think, but there's so much we don't know, and I think that there's so many things we need to explore to help people improve and go forward. And your goals going forward, and this is you know, a big study you're taking on board, in the sense that it's a lot of, I can imagine, a lot of time and effort and so on and so forth. But are you okay to share what your goals are going forward with the research? What are you looking to achieve in terms of the big picture?
So hopefully with this model, it will be able to be used by all health professionals. This is like really what I hope for, that all health professionals can use this as a guide to conduct their consultations. It isn't specific like ask patients X, Y, and Z. It's more like, you know, be friendly. Some things may be considered common sense, but you can sometimes see it in some consultations. It doesn't happen, especially with GP consultations. I hear a lot of patients saying that they felt GPs were cold, and they weren't really listening. They're always facing, you know, typing on the computer. Sometimes they don't even read the notes, and yes, I mean, in terms of their history, and they don't have a relationship. So these are all things that some people might know already, but basically my guide will be there to help practitioners increase advice being taken on board, in particular, or taking on treatments like herbs, or more acupuncture, you know, more sessions, appointments, to increase the adherence, and also maybe if possible, I mean, depends on the results, I would like to develop an intervention, so like focus on a specific area that perhaps we can really develop, and try and get people to I can't be any more specific than this, because
no, for sure. I think so. I think that, you know, it's a great research that you're doing, and certainly my experience, to share my experience, and from the GP point of view, I would say personally that, and by the way, I'm not medical qualified, and I'm not sort of, you know, pulling any punches, anything like that. I deal with the mind, but from the research point of view, to sort of contribute my thoughts, I would say personally, my experience going to the GP, it tends to be really causal, and I think, in my opinion, that works really well when it's, say, for example, an infection. So you've got an infection, you go there, you get the antibiotic, and it's kind of, you know, that sort of causal link, take this, and infection here, so to speak. But equally, there's a broad range of conditions that are along a certain spectrum. And I think certain things, for example, like, say, you sprain your ankle, then it would make logical sense to get a cast and reset it, so to speak. So one thing. But equally, there's a broad range of areas as well that I think that, for example, someone goes for depression or anxiety, then it's multifactorial. And certainly in my experience, if someone, for example, who comes to me for pain relief, and one of the modalities I work extensively with is hypnosis, and hypnosis is quite useful around pain relief. Before I do any pain relief with a client with hypnosis, the first thing I do is suggest they go see a GP first of all, to make sure they do a battery of tests to examine the pain. And I do that because obviously that sort of pain in their back they might have, there's a percentage that it could be a tumour that could, that's not saying anyone's pain's got a tumour, but something that could be treated, so to speak. So I think it's really important. Now I say to them, okay, I'm not saying I can't help the pain, but first of all, go down there and see something they can do. So I try and use a holistic approach, because the biological side is not my place to work with. I've looked at the cognitive side, and before I start working with people and doing sort of because the hypnosis and pain relief is distraction and absorption. And cutting a long story short, a bit like when you walk, you've got a pebble in your shoe, you don't notice it until you stop. You put in the garbage, you've got cuts, you don't notice because a sports person gets injured and they keep playing because they're so absorbed, so you kind of have that focal point. There's scientific evidence to suggest that and the pain receptors you can sort of shut down by using hypnosis in certain situations. So the point being, in my experience, I would say there is that spectrum and somewhere in between. I think, in my opinion, that sometimes the modern medical process, it can be very biologically reductionistic, but that might be time, it might be what the GP is comfortable with. So the person might go to GP and say they've got depression. Well, obviously they've got a set time they can help that person with. But equally, I'd like to think someone in the future that sort of explore other options too and look at the cognitive side. We know that we can change brain chemistry by going for a walk, but we know we can do certain things. But then that might not be appropriate for certain cases. So I'm not one to dismiss. I think that it can all work hand in hand. And your thoughts, do you think that all these things can sort of work under an umbrella? And it's possible to do that?
I mean, that's what I really hope to try and do with my research, is try and like integrate, or like, I mean, with future research, if it's in a slightly different area, but just to like what you were saying, integrating the two forms of medicine. Again, with my previous study that I just did with Chinese medicine, patients were really appreciated when practitioners referred on. It wasn't to their area of expertise. For example, if in terms of like anxiety, and they were a Chinese medicine practitioner, they felt like, oh well, it's not my, like, I think you really need hypnosis, but I'm not a hypnotist, so they would refer on in that sense, as well as referring on to like the GP to see, or special, like asking them to see a specialist if they had problems that they could, they didn't have the equipment to test, or the specialism. So yeah, I think being able to recognize what the practitioner is capable of, and also, but at the same time, patients also needed reassurance, or liked feeling reassured that the practitioner was confident, and they were calm and knew what they were talking about. Well, they usually felt that way. Otherwise, I would think they would see a different practitioner. But yeah, seeing the cases, or successful cases in the past that they've had of someone with a similar problem, those things instilled confidence in the patient, and for them to believe that this treatment might work. Even saying that, I had interviewed some patients who were skeptical at first. They were saying like they didn't believe it, but they gave it a go because Western medicine could no longer help them, or their family recommended them, so they thought, okay, I'll try it. And despite thinking that it didn't work, when it did work, they end up being one of the most, one of the people who would rave about it the most, or like, I want to tell everyone about this therapy, it works. Like, I think everyone should see this practitioner. So they became very, I think, with the change, or experiencing that personal experience of it working for them, or yeah, there has to be like a positive effect for the main condition that they sought treatment for them to continue on with treatment, regardless of whether they're friendly and warm. I mean, there has to be a treatment effect from the research that I have found. So yeah, I'm just rambling.
Yeah, no, it's interesting stuff. I think you raised some really important points there. The important points you raised there, I think, are around the belief, and I think that placebo and belief, and I think that if someone's sort of a big advocate of, say, Chinese medicine, or any medicine for that matter, then going into the research, it's very likely going to have less resistance. But equally, saying that, you made a really good point about the skeptical, and someone's skeptical and can see improvement, then that's is significant for me. But also, all things said and done, it's sort of putting it through a model that you can test it scientifically and get statistical power and the data necessary to get an idea of how effective it is. And that's a challenge. I don't think it's easy in that respect. I think from a medication point of view, it's a little bit more straightforward in my opinion, because you can sort of give one person this and give one person that, and one person a placebo. From a psychological point of view, it's sometimes a little bit more challenging in one respect, because certain conditions in the psychological world are hard to measure. In one respect, the purpose of, say, any therapy is to go from allopathic to adaptive, so it's difficult to measure. And it's hard to measure because sometimes it's like the chicken and the egg. They get better because they have that treatment, or what so influences what. And obviously, from a psychological point of view, with different treatments, the challenge is you don't really have that sort of placebo group, in the sense that, okay, one might take medication, one might try this psychological intervention, but you can't placebo someone a psychological intervention in saying that, what you do in that respect. So it is fascinating. I think that, from the point of view of the data, and what stage are you on in terms of any data that you can share so far? In still early days, or where in terms?
At the moment, my dropout rate for the survey is very high. It's about 50%. So
wow.
there isn't much I can share apart from that, because it's such a small sample at the moment. I don't know if the findings are statistically significant. Yeah,
yes.
I would love to though. I can share with you more findings from my last study. But yeah, with this one, I know maybe in a few months I'll be able to share with you.
Yeah, no, definitely do keep in touch. I'd be interested to see how you get on. And it's never easy in any study, obviously. And people drop out for various reasons. It's anybody's guess in saying that. But from the point of view of statistical significance, then it's dropout ratios really puts the study in many respects. But your previous study, any details?
Yeah, so my previous study, when I developed from, was basically interviews with patients, interviews with practitioners, and observations of the consultation. And through that, I had developed the model, which is kind of separated in two streams. So one is what the patients felt, which is the main outcome, and then the behaviors that practitioners can exhibit to help patients feel those identified as important for adherence. And basically at the core, patients feeling cared for motivated adherence to Chinese medicine. And to achieve this feeling, they needed to develop, practitioners need to build a relationship with them. And to build a relationship, basically you start with laying the foundations of creating comfortable environment, making them feel comfortable with a relaxed environment, being warm and friendly, toning them up. And then the next step on top would be to enable patients to feel understood. So by communicating well, especially listening and empathizing. And then on the next step after that would be to enable the patient to feel known. So remembering their preferences and then behaving in a way that is most suitable for them. So some people prefer a more professional approach rather than the matey kind of friendliness.
And yeah, no, definitely.
Yeah.
Yeah, I mean, it's good for sure. I think people respond in different ways. That's for sure. And I think that just sort of doing things individual as you see fit, so to speak, and going from there. And in terms of your own development in the area of Chinese medicine and Vedic medicine and so on and so forth, is that an area that you sort of continue to sort of research and look into? And I guess my question too also is, in some respect, the practicality. I don't know which came first, Indian medicine or Chinese medicine, or probably roughly at the same time, with Egyptian medicine, whatever it is. I'm sure the similarities, there are some parallels there to a certain degree. But the practicality, Emily, in the modern world, because let me give you an example of what I mean. Say, let's take mindfulness, for example. It's really widely used now. I was sort of practicing mindfulness many years ago, but one of the things I sort of mentioned is okay, The challenge is that the world's in place to what the world was when some of these principles, which are 5,000 years old, now, I'm big believer in mindfulness, and I think it can have a big impact. But equally saying that, I think there's certain people going to struggle. It's got to be adapted to the modern world in the sense that, okay, some people say something we need to live by. I say something we need to integrate, because the world we live in, the modern world we live in, is quite fast-paced, and I think there are certain people who've had trauma, for example, and they struggle to sit there. You know, the fight-flight-freeze system, the brain is not working as well as it could do, and to sort of sit there and be mindful is no right. We're going to struggle. So for me, it's about adapting it in various ways. And do you think that, from your point of view, the Chinese medicine, do you sort of constantly research? Is it something that you have to adapt to the world we're living today, or your thoughts on that?
A lot of research is still continuing with Chinese medicine, and they are adapting it, I believe, it's not a medicine that just stands still, although a lot of people have that perception that it's just what people did in the old days and that's it, but people are still continuing to improve it. There is just modernizing it, simply like making into pills or different formulations, but also like different combinations, testing out combinations of herbs to see if they work, can be proven that it works scientifically. It's very hard because with the herbs, they're individualized. It's not just one or two. Usually you have like around 7, or it really depends on the herbalist, I should say. So like 5, 7, it can be up to 15 or even more in terms of combinations. It's very hard to prove that it's one specific herb. And if it's a different person, they may not need the exact same 15 herbs, and may need 14 of the same and a different 15th herb or something like that. So it's very hard to prove scientifically. It's one of the challenges with Chinese medicine. However, there is research trying to prove that it works. And I think one way was more testing like cell-based. One of the things you have to do before you test it in people is to test it in the lab, if there's efficacy and if it's safe, even though it's regularly used in everyday life, perhaps even.
Yeah, and that's a challenge to identify the correlations and the variables. So it's going to be a challenge. I think that one of the challenges is we've got ethical guidelines as well, and I think that's, I'm not disputing the ethical guidelines. I'm just sort of putting it out there that can be a challenge in identifying these correlations, because obviously there's people you can run tests with. There is that possibility in certain situations where using different models, using animal models, using other variables, whichever way we look at it. Use an animal model, it's never going to be completely a human being genetically, the DNA, albeit there is some use. For sure there are some parallels there. Equally, the ethical guidelines around testing people with certain conditions, it makes it difficult to identify what causes what correlates with what, but you can only do the best you can with what you've got, and I think what you do is fascinating. I really think it's a fascinating study. I'm looking forward to hearing more, and I think that the more people like you, Emily, the better, in the sense that it's about, I believe anyway, it's about having an open mind and putting people first. That's the key to all of it. In the end, we just want to help people be as good as they can be and go forward. So, really, really thank you for coming on board. Obviously, like always, make any recommendations to anybody to do their own research, and obviously each case is on a formulation. People aren't feeling great, go down the proper channels for sure. But do keep an open mind. On a final point, is there any way people can get in touch with you to know more about your research?
Yep. Well, I'll hopefully be publishing some more. But if anyone has has any questions, they can just contact me via email, and I will send you the my email link to put up for people to contact me.
Thank you, really appreciate that. Yeah, thanks for coming on board the show. I really appreciate it. Thank you.
Thanks, Jim, for having me.